All right, Dr. Emer, we're live.
Hey you guys, it's Dr. Emer, and we are here in the weekend. I'm really excited to be doing my mega lift with one of my clients who looks absolutely amazing. She's been following all of our skincare protocols. She's been coming in for facials and lasers and peels, and now we are going on to skin tightening. And what we're doing next is we are doing Instalift. And this is a bi-directional cone lifting treatment that takes sutures and puts them into the skin, under the skin of the surface of the skin to get it to tighten. And this allows me to pull the skin up while the patient's awake. Rather than surgery, we are able literally to insert these little threads that are going to build collagen under the surface so she gets nice lifting and tightening without having to have surgery.
All right, so we just answered a few of the questions right now. People asked if she was under anesthesia. Guys, we did do some nerve blocks to her beforehand.
Scissor.
Right now, people asking what procedure this is. This is the mega lift right now. This is going to lift her face in all directions.
Tell them what it is, what
right
it's
now,
made of.
we are using Instalift threads and PDO threads.
So this
right
this is the bi-directional cones. You see there's a space in the middle and the little cones on the bi-directional thread. Bi-directional means we go from the middle and we pull on each side to tighten the face. And this goes under with very minimal pain, if any. She has nerve blocks in there, and we use the thread in a way that's in a special vectoring technique, you guys. So the vectoring technique I use was developed by me to give her the most natural, tighter look. She'll see a little bit now, but the majority of the tightening is gonna come in it's about 6 to 12 weeks. And honestly, this lasts up to 2 years. I have patients that do this and do this every year or two just to keep the degree of tightening going and keep the collagen production. This is made of a sugar-based thread, what's called PLGA. And PLGA is similar to Sculptra in that it builds collagen as the body absorbs the thread. And this is the mega lift because we are doing a mega lift. We are literally tightening her entire face and neck at once. And it's unbelievable how much she'll get from it. And you guys can see already, look at the areas we can pull. And it is just a great combination to add this to your external treatments like Morpheus for tightening, dermatological therapy for preventative skin sagging, Sculptra injections to build collagen and do some sculpting of the face. I'm very excited because my patient looks very young and we're going to keep her looking that way. And when you look young, you feel young, you know, it keeps you vibrant. How's the pain? Is there any pain?
Negligible, very, very good.
Oh my God. Needle?
Next to nothing.
That's amazing. I know people always see this and they freak out. They think that there's so much pain involved and that my patients are being tortured, basically. But why would I ever torture someone? I have a mini dachshund, you know? Got people that own mini dachshunds don't torture anyone, I'll tell you that. So we are also now sculpting the edge of her jaw. We'll go right onto the edge of the jaw, right to the angle of the mandible.
Can we hit the comment section right
What are they
now?
saying?
All right, people asking, is it $500 for the consultation? That is for a consultation with Dr. Emer. We do offer consultations at different rates for our treatment coordinators, like Nisha the PA over here.
Hi, Nisha.
Hi guys.
You can do Nisha the PA, you can do virtual consults or even skincare consults. All have different pricing, and all of our staff, you guys, follows the same protocols. They follow our methods, they learn the best techniques, they know exactly what to do, what I do. So I'm very confident that if you make an appointment with Nisha the PA, you're going to get a great recommendation treatment. Lift your chin up for me a little bit. So now
Right.
we're gonna do part of this lift that I call the spider web lift. Okay? And this is on 90 mil.
Okay, guys, people asking about these dimples right here, guys. These dimples will dissolve. Our previous
Little
patient,
nothing there.
if
Didn't
you look at our
really
IG
change it
live,
slightly, I'm sorry.
who had Instalift, we did the whole mega lift for her. Her dimples are now dissolving. They take about 6 weeks. You will not have any scarring or dimples. They fade away, so no need to worry about that. And that is one of the biggest concerns
What's up, is high?
for people getting the Instalift.
Perfect. Good. So with this technique,
Someone is saying, I could do this, looks easy. No, guys, do not try this at home.
I highly doubt it. Turn
Do
to the
not
left.
try this at
Are they
home.
joking or serious? I'm nervous if they were serious. So I honestly make it look really easy, but it's not the easiest thing to do at all.
Guys,
Look at
these
that
are
tightening, you guys. Look at that. Right
Give us
there
a
on her
little
jaw.
tug.
Look at that jaw.
Oh my gosh.
snatched.
Oh my gosh.
She is now snatched.
And if they want to consult me, no fee, only
So
dinner.
they have to
Dinner
take.
and drinks.
You have to take her to a really nice dinner and drinks, and our request for dinner would be at Providence, please. Take her to Providence. It's only one of the best restaurants in Los Angeles, but you know, why not? Okay,
Can this
turn
be
the
used
left
to
a little bit
lift
more.
sagging breast?
It really honestly can't. You know, people have tried to do that for so many years, and the success is very low with that. I would not suggest it.
Okay, guys, so more people are joining us. We say, yeah, guys, this is Dr. Emer's Mega Lift. We did the brows with PDO threads. We're doing Instalift threads throughout the rest of her face, mid-face, lower face, jawline, and neck.
There you go.
These are bi-directional cones that will be activated when Dr. Emer presses on them. And then over time, the dimples will go away within 6 weeks. She will not have any scarring, and her face will be very tight and contoured.
I'm gonna leave it at these two here. Give me that. There we go.
Are you on a liquid diet after the threads, or can you eat normal food?
No, you can eat normal. Here, tighten this. Tighten this. I'm gonna do the PDO really quick. Hold on. So let me see
There you guys.
this angle.
Where is the nerve blocks placed? They want to know.
Well, that's not something we tell you.
I can't tell you all that.
Can't
The
give
doctors
you
must
all
be
our
on here.
secret. Hold on, it's okay. Let's do more. Let's try. Let's try one more. Trying to add a little bit extra. I want to give her special patient, special treatment. So I want to give her the best lifting we can. I'm going to add a little bit more to that spider web lift. That. To give her a little bit more. There we go. Excellent.
How are they able to go back into the gym right after this?
You
They're
know,
asking.
a lot of people say to wait about a week before going to the gym, movement, smiling, laughing. I've had patients take a week off and not even talk for a whole week. Do a meditation week. Hold on. I'm giving you a needle. Hold on.
Do you need to wear pressure bands after this?
Not really. I mean, scissor.
Guys, why is it not hurting her? It is because she has nerve blocks done. Our patient is feeling great right now, and she's gonna look great too.
Okay, so now we're gonna go back to the brow. And we're gonna do a couple PDOs here. Now we're going to use a different thread type. Turn it left a little bit. There we go. Okay. And this is a PDO thread. This thread is going to lift that brow. So you can see that here already in that little bit. Look at this. Watch. See? I like going in the hairline. It makes it harder though, but it's nicer to do because the end result is a little bit more tightening, and it's hidden. Look at that. Keeping your eyes closed. Hold on, do that first.
It's really amazing.
Scissor. Actually, it's easy. Look at that brow elevation already. Look at that. You could see that. Crystal knows that. She's like, And so I really want her to get fully lifted. The corner of the eye. And sometimes we do different techniques for different people. Okay. Let's make sure her hair is perfect. Good. Maybe a little light on here or no? Maybe a flash. Right, there we go. Good. Also make sure the hair. We're always making sure there's no hair that gets into our thread because we don't want that to go into the skin.
How does gravity
Now,
affect our
Look
wrinkles?
at those brows. Look at that elevation in the brows, you guys. So what we're gonna do now, gravity affects wrinkles in a negative way. Gravity takes everything down. That's why your balls and your boobs start to sag. Gravity takes over, okay? Unfortunately, if you don't work up or thread it, you're gonna fall. So now look at that arch. Look at that beautiful brow arch. We call this a gull wing arch. That's the elevation and lift, and now her upper lids and her brow are significantly improved with no signs of removal or of placement. I'm also going to tighten the threads. This is called activating the cones. So I'm going to activate these threads. Now we're going to create some dimples here. These dimples can last a couple days to a few weeks. I know it feels a little weird because we're really, really pulling. Look at how much tightening she's getting. It's almost an inch. This is one of the best tightenings I've ever seen, ever. Okay, on a live and a lift. On the neck, I'm also much more aggressive with the tightening. We need it to pull right into that jawline. Look at that. See that? The dimpling? You could see these cones are getting activated. They're pulling. Look at that degree of tightening there. So we need her skin to really activate these cones. And so I check, make sure. Please don't just watch my videos and start doing this. Okay, because it's not as easy as this looks. Alright. Perfect. We need placement to be perfect. Alright, scissor. And now we're gonna cut the threads and let them rest. And then the biggest thing here is just to cool it with too much activity for at least 72 hours. And then you watch it tighten over 6 weeks. And remember I said this will last up to 2 years, but in the first 6 to 12 weeks is when people start to really see it, and then in a year they look so much younger. So now we bring this face straight, put your chin up a little bit. Look at how much tightening you have there. Look at how much lifting from here to there. It's significant. So that is basically mega lift. We're going to continue on the other side, and we can keep you in touch with our patient over the next few weeks as it heals. Full face, lower face and neck Instalift, brow, PDO threads, This is more of the gull wing look, not the cat eye look, because I just wanted to have a nice open arch. So that's it. Any questions, or are we good? Turn all the way
We're
right.
good right now. I've answered the
All right,
questions.
you guys, have a good weekend. Let's do the other side.
Okay.